going to guess this sounds like you. You get all ready for a run, lace up your shoes, and then not even 2 miles in, your hip starts to hurt. It's this sharp, nagging pain right over the side that just forces you to stop your run. So you rest for a week, maybe 2. You feel better, get your hopes up, and then the whole frustrating cycle starts all over again. Run, hurt, rest, repeat. It feels like an endless loop. And honestly, you're about to give up on running for good. Sound familiar? You probably feel like you've tried everything. More stretching, more foam rolling, even taking a whole month off from running, and nothing works long term. You're about to accept this as your new normal until you discover a simple, powerful 3-step plan that doesn't just mask the pain, it fixes the root cause. In this video, I'm going to break down the exact plan for you step by step so you can finally end your hip pain forever and get back to running strong, confident, and completely pain-free. Hey there, I'm Dr. Abby Siler, doctor of physical therapy and runner myself who has treated hundreds of runners out of hip pain, knee pain, and other issues to running for life pain-free without any injury. Before we get into the how, we have to understand the why of the hip pain. Because if this story that I talked about sounds like your own, you've probably been given a ton of confusing advice. There's a lot out there. Maybe your physician said hip bursitis or tendonitis and handed you some anti-inflammatories or recommended a cortisone shot and just told you to rest. And while that might make it feel better for a while, it doesn't solve the real problem. The pain almost always comes back. And here's the thing that changes everything. For a huge number of runners, the pain you feel on the side of your hip isn't actually a problem with the hip joint itself. While joint issues can happen, it's far more often a symptom of something deeper, weak and imbalanced muscles around the joint itself. Think of your pelvis as the foundation of a house. When you run, every step sends impact up through your body. Not a bad thing, it's just part of the nature of it and we're built for it. But the muscles on the sides of your hips, especially the super important one called the gluteus medius, which we've talked about before, are supposed to keep that foundation stable and level. Their main job is to stop your hip from dropping side to side with every single repetitive stride that you do during running. But for a lot of us, especially if we sit a lot, these key stabilizing muscles get weak, and it can be a natural part of aging too. And when these muscles aren't pulling their weight, 2 things will happen. First, other smaller muscles and tendons around the hip are forced to work overtime, trying to do a job they weren't built for, and that leads to the inflammation and irritation we call tendonitis or bursitis or tendinopathies, actually, is what we've really learned about. And then second, your running form starts to break down. Your hip drops, your knee might cave in, and your whole alignment gets thrown off when you're running, basically hitting the brakes with every step you take. And this doesn't just waste energy, it puts a ton of strain on your IT band, your hip flexors, and even your lower back. So all that stretching of your hip flexors to make it feel better, it might feel good for a minute or 2, but it's not fixing the weak hip muscles that are causing them to be overworked in the first place. And the rest, yeah, the medication and ice, and it calms inflammation down, but as soon as you start running again, the same weak movement pattern takes over and the pain comes right back. You're just stuck in that loop over and over again. So the key to getting out of this cycle isn't to just treat the symptom, it's to fix the weak link in the chain. It's about waking up and strengthening those sleepy support muscles, and that's exactly what my 3-step plan is designed to do. This is the exact plan that will take you out of that frustrating pain cycle and into a place of strength and resilience as a runner. But it's not a magic pill, and you've got to be consistent, but it works because it goes after the root cause we just talked about. So step number 1 first is we have to break the pain cycle. When a tissue is angry and inflamed, you can't really strengthen it, so we need to calm it down some. But, and this is a big but, this is not about stopping everything and becoming a couch potato. Rest is out. Rest is not best. That just makes your muscles weaker and stiffer, and we need to do some strategic deloading. This means you'll need to decrease running, sometimes stop for a bit. I really try not to let people stop the thing that's, and because you need to stop the thing that's causing the sharp pain. You have to listen to your body If an activity hurts, don't push through it, modify it. But instead of doing nothing, you're going to swap running if needed for low impact cross training. Things like swimming, cycling, or incline walking are great. They keep you fit and keep your joints moving without the repetitive motion that's ticking off your hip. And if you're needing some ideas on how to cross train for your given pain point or injury, because there are right or wrong ones, I have a whole PDF just about that, which is linked in the description below. It goes through a 4-week cross training plan as well as the recommended cross training activities for your given area of injury. So during this phase, which might be a week or two, depending on how you feel, you can use ice on the sore spot for 10, 15, 20 minutes a few times a day to help with any sharp inflammation, but only if it makes it feel better. If it doesn't do anything, don't waste your time. The goal here in this phase is simple. Let the irritated tissues chill out while we get ready for step 2, which is where the real magic happens. And I say you need to let it calm down for 1 to 2 weeks, but I actually, during that calm down phase is when I want you to start doing some of these exercises and the ones that I'm talking about, step 2. Step 2 is when we rebuild and strengthen. We are doing targeted strengthening for the hip. This is the most important step. And like I said, it can start at the same time as step 1. Step 1 is decreasing and modifying activity, while step 2 at the same time is adding strength. Once that sharp, consistent pain has settled down, especially if you can do these exercises without that sharp pain, then we need to start keep strengthening these. And these exercises aren't about lifting massive weights. They are all about precision and control. You need to focus on feeling the right muscles doing the work. And the 3 foundational exercises I use with all of my runners for hip pain to start with are the clamshell, the glute bridge, and the side plank or side bridge. They are what really target that glute medius muscle that helps decrease this hip pain. If you want more detailed information on how to do those, check out this video here and linked up at the top, wherever it goes. Know that this is a starting point. You can't just do these exercises and expect a miracle, and these aren't the end-all be-all, only exercises that will help with your pain. But they are a good starting point, and you will need to progressively strengthen this area to really get back to running and prevent the pain from coming back. Now, if you want a done-for-you program, I have a 12-week hip protocol for runners that is linked below. It is the exact protocol I use with my runners in the clinic, and it really progresses the hip strengthening exercises from the basic clamshell bridge and side bridge all the way through the spectrum like you need to do to really become a resilient runner. But as a starting point, those 3 exercises are perfect and exactly where you need to start. Now, the final step is to take this new strength that you are building and actually use it in your running, while building habits that stop the problem from ever coming back. First, you have to ease back into running gradually. Even if you never stopped running, you can't, as soon as the pain goes away, can't go back to your previous mileage. Cut it by 30% if it's only been a week or 2 of pain. If it's been like a month or 2 of pain, cut your total mileage in half and then gradually build back up. If you're still having some pain, one of the ways that you can modify your running is to do run walk. See how it feels. If you can run for a minute without pain and then you can walk for a minute and it still doesn't have pain, go back and forth and do that. The 10% rule is still your friend here. So when you get to find where you are able to run with less than a 2 out of 10 pain, with that modification, and based on this video up here with some advice on how to know how much to run and what you should and shouldn't do based on pain, then you start progressing based on that 10% rule. But know that this isn't a hard and fast rule. You might have to do 5% of an increase depending on how your hip and your pain is doing. The second part is pay attention to your running form. You don't need a complete overhaul, just a couple of simple cues for your running form. Think about running tall with your chest up, and most importantly, try to have your feet land underneath your hips, not way out in front of you. This is called overstriding, and it makes a huge difference in reducing the stress on your hips if you're not overstriding. A slightly quicker, shorter stride is almost always more efficient and safer for a runner. And then finally, in step 3, the long run, make strength training a permanent part of your routine. You don't have to do all 3 exercises every day, but getting this routine in 2 to 3 times a week in the beginning, maybe on your non-running days, will help maintain your hip stability and keep that pain from creeping back in. Just think of it as an essential part of your running body form and for part of your training. So there you have it, the 3-step plan to end runners' hip pain for good. First, you calm it down with smart rest and cross training to break the pain cycle. Then we're going to build it back up by strengthening those key hip muscles with things like clamshells and glute bridges. And then finally, you integrate it in by returning to running gradually with better form and making strength work a non-negotiable part of your week. This isn't a band-aid. This is the plan that gets to the root of the problem. It breaks the miserable cycle of run, hurt, rest, repeat by building you a stronger, more stable foundation. You're not weak, you're not broken, your body is not bad at running. You just need the right game plan to fix the imbalances that were holding you back. Commit to this plan, get the 12-week plan that has mobility and strength in it. Be patient with yourself, and you won't just get back to running. You'll do it with more strength, more confidence, and without that fear of the nagging hip pain coming back to haunt you. Now, if this video helped you out, please hit that subscribe button and ring the bell so you don't miss what's next. And hey, I really want to hear from you. Drop a comment below and tell me about your experience with hip pain. You are definitely not alone in this. We are all here for you. If you want to really dig deep though and have a custom support schedule, a free consult call with me today, that link is also in the description, and I'll see you next time.